Thank you for the opportunity to tell you about the Deepavali Charitable Trust. This video tells you a little bit more about our mission, our chosen partners, and to ask for your help in serving humanity. Most of us know that there is a lot more satisfaction in giving than there is in receiving. Giving makes us feel valuable. It gives purpose to our lives and makes us feel part of something bigger. The charity is run entirely by volunteers, so that nearly 100% of your donations go to the actual causes. Deciding to give can be complicated. There are so many worthy causes out there, it can sometimes be overwhelming. Ultimately, we end up choosing a cause that we are passionate about, or one which we can relate to emotionally. Deepavali Charitable Trust is a public charity dedicated to supporting benevolent causes in rural India, operating in regions of extreme poverty. Its mission is to better the lives of the underprivileged and needy, irrespective of color, caste, or religion. Deepavali is a tax-exempt, non-profit New Zealand-regulated charity. It is entirely run by volunteers. Nearly 100% of your donation goes to the actual causes. You might ask, how is that even possible in today's day and age? Not only is the fundraising organization in New Zealand and Australia run by volunteers, Deepavali has a long-standing charitable partnership with a unique charity in India. Our partner charity, called Kripalu, is based in Uttar Pradesh. It has an impressive infrastructure of a large number of selfless volunteers and logistical network. Uttar Pradesh is the largest state of India, with 180 million people, with 90% of them living below the poverty line. Our partner in India has hundreds of volunteers, from doctors, nurses, accountants, and many other professionals who take no salaries, as they are inspired by their personal commitment and a higher calling. Not too different from Mother Teresa's missionary of charity in Calcutta, as it is essential that each donation is dedicated to supporting the people that need it the most. Deepavali works together with Kripalu to ensure that the infrastructure and processes are in place to channel the donations in the most efficient way possible. Kripalu has a long history of charitable work in India and has been recognized by many government organizations for impacting the lives of rural Indians. Our partner has received many awards, including the Nelson Mandela Award for selfless contribution to society and the Mother Teresa Award for educating girls. It is an organization that believes in the highest standards of quality care for the poverty-stricken. We feel very privileged to be working alongside them. We fulfill our mission through 3 key initiatives: healthcare, free quality medical care at 3 100% free charitable hospitals, and comprehensive health outreach programs. Empowerment of women through education, providing free education to over 4,500 girls each year, from primary school through to college. And disaster relief services and financial support for basic sustenance for the needy. Let us tell you more about our specific initiatives. There are many areas in rural India where proper medical facilities are not available. Of the health centers available, the majority of people cannot afford the cost of basic treatment and medications. Hence, they are deprived of proper health care and suffer terribly. Within healthcare, free cataract operation camps are organized routinely. Through our associated partnership with Kripalu, we support 3 fully charitable hospitals. Mangar Village in Pratapgarh district was inaugurated on 5th November 2003 and serves around 18,000 patients each month. Bersana Village in Mathura district was inaugurated on 14th January 2007 and serves around 8,000 patients each month. Vrindavan is the newest hospital, which was inaugurated on 18th September 2015, serves approximately 18,000 patients each month, and this is likely to increase over time. All medical services, from simple treatments to life-saving operations, all medicines, follow-up care, are provided 100% free of charge to any patient who walks in. And many patients come from villages that are over 100 kilometers away. These 3 hospitals provide medical care for approximately 45,000 patients each month, all for free. With the exception of a few specialists, the entire hospital is operated by volunteer staff who are passionate about healthcare in rural India. This further ensures that every dollar raised has maximum impact for the patients. We all understand that the long-term solution for developing countries is education. They say, give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. Although India has advanced its educational policies, the fact is, most families still have to make a choice about which child attends school. In most cases, girls are not the ones who are educated. Did you know that even today in rural India, 1 in every 9 girls is coerced into childhood marriage? Girls are pulled out of school as early as 9 years old and used as a child laborer on farms or as a kitchen hand. We strive to help break this cycle of poverty. These girls are potential future leaders and mothers, and each of these mothers are in turn the first teachers when they have a child. We are already making intergenerational change with decades of positive impact. The educational programs of women empowerment are 2-pronged. 1, for over 4,500 girls through a primary school, an intermediate school, and a college, much like a liberal arts and sciences college here with bachelor's and master's degrees. Provide comprehensive education to be self-sufficient in a small village of Kunda, where girls lack opportunities and financial resources to study. And 2, for those young women who have missed out on early education, there is an initiative to construct a women's vocational training institute to provide skills in specialized trades, such as bakery, cosmetology, and sewing. This includes providing free uniforms, school bags, school supplies, free transportation, including bicycles for girls coming from distant villages, utility items, and hygiene supplies to nurture them into economically self-reliant women. For us, the ultimate in empowering women and impacting future generations is through education. Those who have the least lose the most in natural disasters. India has its fair share, and ultimately, the need for financial aid and help outstrips demand when a tsunami, flood, or earthquake strikes. Our 3rd initiative is relief services in India and is made of a series of humanitarian programs. Here is just one example. When a group of patients came in for treatment during a healthcare camp in winter, they found that many patients did not even have basic warm clothing. So after their treatment, the same hospital volunteers helped in providing blankets to all the patients who had come there. Although this initiative is more on a needs basis, it is just as impactful in the communities of the poverty-stricken. Those who have the least lose the most in natural disasters. We also provide financial aid to the victims of natural disasters, floods, and earthquakes. Aid, in the form of free blankets and basic essentials, attempt to alleviate some of the suffering that disasters bring upon in rural India. One program involves construction of toilets for women in rural parts of Uttar Pradesh. A very simple act of kindness and of basic dignity for women is a highly impactful, benevolent program. Yet another program helps widows in rural India. With no fault of their own, widows get shunned by rural societies, ostracized by their families, and thousands of widows from all across India go take shelter in one city of Vrindavan. Through our partner organization, we help provide meals, winter wear, cash, and household utility items on a regular, ongoing basis. To summarize, Our platform is like no other international charity. All in-house school staff, teachers, doctors, nurses, administrators, support staff are volunteers who are internally inspired and motivated to serve and make a difference. It is truly a sight to witness. While we do pay for some external professional staff, specialized teachers, and some doctors who are specialists to provide high-quality care, all administration, management, and maintenance staff are volunteers. The most effective way you can help is by your financial contributions, which go directly to operating of the hospitals, running of the schools, and provide relief services for the needy. Please reach within your hearts and make out a contribution to Deepavali Charitable Trust today, and join us in supporting these benevolent causes. By working together, we can achieve a whole lot more to serve humanity. We sincerely thank you for your time.